Prakash. Now I would like to invite Mr. Mohammad Arshad, Director Technical, Sehat Sahulat Program, and the topic of his discussion is upcoming National Universal Health Insurance and its implications in the national health sector. Thank you.
Bismillahir Rahmanir Rahim. Thank you, Asfar and your team for inviting me here for a talk. मुझसे पहले अजहर साहब जब 1984 का जिक्र कर रहे थे, पहले कंप्यूटर को पाकिस्तान में असेंबल करने का, तो his talk took me back in 2002 when I was heading Pakistan's largest health insurance company. And out of my own passion, I created Pakistan's first healthcare website, healthcare.com.pk, with an intention to just put Pakistan's or health insurance basic data on the web platform. There are always humble beginnings. There are always a first step to a big journey. मुझे अभी आपसे इस प्रेजेंटेशन पे बात करनी है. I will share कुछ ऐसी चीज़ें जो शायद आप में से बहुत सारे लोगों को आज से पहले पता नहीं होंगी. 2021 पाकिस्तान के हेल्थ केयर सेक्टर के लिए एक नया साल होगा, एक संगे मील का साल होगा. क्या आप तसव्वुर कर सकते हैं, ऑन दिस प्लैनेट with more than 214 plus nations, a nation like Pakistan, which is the 5th largest nation on this planet, more than 234 million souls in this world, going to launch first ever universal health insurance coverage, a state-sponsored universal health insurance coverage, which will be a unique phenomena, and it will not be a pride for me or pride for the Prime Minister of Pakistan only, but for the whole nation. But it's just a beginning. It's not possible without digitalization. It's not possible with all stakeholders wholeheartedly support. As you know, before I go to the formal slides, I was sitting last year in my official meeting with the State Bank leadership in Karachi. After the formal discussion, we were having a chit-chat on a coffee session, and the guy, the senior-most guy, I don't want to name him here, he just asked me, Arshad, have you any idea what kind of income inequalities exist in Pakistan? I said, yes, I have a little idea, which I heard in my business school, IBA Karachi, or elsewhere during my foreign studies, or like a common man from the media or social media. But I would like to hear from horse's mouth. मुझे आप बताइए, what kind of income inequality is prevailing in Pakistan now? He said, Arshad, only less than 1% of Pakistanis earn 100,000 or more than a month. 92% of Pakistanis earn less than 30,000 a month. 62.5% of Pakistanis earn less than 10,000. Now imagine, maybe it is a little plus or minus. With this kind of income inequalities or poverty structure or the social justice level in our country, within our nation, if tomorrow at 3 a.m., कल सुबह 3 बजे, मुझे, आपको या हमारे किसी प्यारे के लिए, किसी हेल्थ केयर एमरजेंसी के लिए 8-10 लाख रुपए चाहिए हों, तो how we can manage? How we can manage? If it is a challenge for a person like me and you, तो how is going to affect a common man? क्या होगा? इस सिचुएशन में क्या होगा? What is going to happen? घर बिकेगा, गाड़ी बिकेगी, जानवर बिकेंगे, जेवर बिकेगा, सब कुछ बिक जाएगा। और वो भी उस सूरत में जबकि हेल्थ इमरजेंसी की नौइयत ऐसी हो कि आपके पास रिएक्शन टाइम हो। You can react, you can liquidify your assets, you can borrow from your cousin, brother, neighbor. With this kind of structure, prevailing inflation, prevailing social values in our society, क्या होगा? वो सब कुछ होता है जो मेरे और आपके तसव्वुर से और बयान से दोनों से बाहर है। For such a situation, इस किस्म की सूरत हाल से निमटने के लिए कौमी सेहत कार्ड या सेहत सहूलत प्रोग्राम का आगाज किया गया। As all of you know, there are three key components of healthcare treatment. One is OPD, outpatient treatment, nazla, zukam, khansi, where you go to your street side compounder sahab or GP sahab, you take 100 rupees or 200 rupees or 300 rupees consultation, take a 500 rupees medication and go home. This is more or less everybody can afford. I can go to Shifa, I can go to AKU, मुमकिन है कि मैं 2-4 हज़ार रुपये खर्च करके किसी पीजी को दिखा लूँगा। गरीब आदमी किसी छोटे जीपी को दिखा लेगा, but still he or she can manage. The second component of the healthcare is chronic medication, जहाँ बीमारी का सिलसिला तवील हो जाता है, डायबिटीज़, chronic hypertension और इसी किस्म की और बीमारियाँ, where you need to take a continuous series of medication or diagnostics or consultations. But the third one, this is also manageable because it's spread over a longer period of the time. But the topmost and the most critical one, which I initially highlighted in the beginning of my talk, is hospitalization, where you may need 100,000, 200,000, 500,000, 1 million. And if it is a cancer patient, if it is a dialysis patient, it's keep going in millions and millions and millions. When a common family, a common man is stuck with such a situation, what happens? वो अपने सारे असासे खो देता है. But still there are only 50% chances that soul, that your beloved patient may cure or not cure. But as per all international and local poverty surveys, for the next 4 generations, the family falls below the poverty line. इस मुसीबत से, इस प्रॉब्लम का मुकाबला करने के लिए the government of Pakistan, हुकूमत पाकिस्तान, has launched the Sehat card program for the Pakistanis. Initially, it was started only for the below the poverty segment of the society, but it's gradually, as per the Prime Minister's vision, being expanded at universal level. I'll go very briefly on few of my slides for the benefit of my professional colleagues, and then I'll have a few concluding words, and I'll move on. Yes, next please. As I mentioned, every year people fall below the poverty line due to catastrophic healthcare expenditure, not only in our country, but across the world. Next. Next, please. We started for the 32.5 PMT, the lowest income level segment, this program, but gradually we realized for the healthcare, everybody is poor, and we need to provide the service to everybody. Yes, next. As I mentioned again, most of the household families cannot go to the hospitals just because of not having money in the pocket. And their beloveds die on the bed. Next. Very little access to healthcare facilities. I'll come in the end. Next. Now you can see the benefit package structure. Budget, being a mediocre economy, we have a budget constraints. We have wish to reduce the poverty, and we wish to optimize the intervention design. Next. This is how this program is working. You can see on your left side, the financer and the regulator for this universal health insurance program is the federal government and the participating provincial governments, while NADRA is the authority which is highlighting the beneficiary exact data, while the insurance company who is purchasing the services from the hospitals and the hospitals who are providing the facilities to the end beneficiary. Next, please. So as I mentioned, initially it was started for the below the poverty people. Then we expanded to the transgenders. Then we expanded to the disabled population. But gradually, now we are moving to the universal coverage. Next. For our purpose, the family means the spouses and the unmarried kids of any age. Next. Now, the most beautiful part of this program that we have a NADRA as our technical partner. When we were about to start this program 5-6 years ago, we have encountered with a very important question: who are the poorest of Pakistan? Unfortunately, we are not Scandinavian nations. We are not a developed economy where I just put a social security number and get out all the data of a gentleman or a family. So we were left with the three options. I had a Zakat Ushur committee database with me. I had a Baitul Mal database with me. And I had a 2010-11, the most latest poverty survey done with the support of World Bank by BISP or NACR for that purpose. So we used the same data. With the help of NADRA, we got verified every family. Next. On 8500, you can send your CNIC number and get your eligibility. This is the benefit package, secondary care and tertiary care. We have the state-of-the-art centralized management information system. I know few of the speakers were highlighting before me that we don't have a healthcare database. We do have. We do have. But unfortunately, being a government organization, sometimes we are working in silos. We need to have a better coordination. We have the Pakistan's largest health database, not only for the 18+ million families, more than 1 million+ surgical and hospitalization interventions. Next. With these CMIS, with these data analytics, I can tell you right now, last week, how many hospitalizations happened in Loralai. What kind of diagnosis? Typhoid वहाँ फैल रहा है, डेंगू फैलने जा रहा है, या कोई और बीमारी वहाँ फैल रही है. कार्डियोलॉजी का इंसिडेंस किस डिस्ट्रिक्ट में, किस यूनियन काउंसिल में, किस लेवल का है. We have the exact data. Now our public health department is not depending on मीडिया's ह्यू एंड क्राई कि जी मीडिया शोर मचाएगा बलूचिस्तान के पिछले डिस्ट्रिक्ट में किसी चागी के इलाके में कोई बीमारी फैलने लगी है तो उसके बाद शोर मचाने के बाद कोई रिमोट टीम में जाएंगी. टुडे वी हैव एग्जैक्ट डेटा every single admission or discharge real-time reflect on my dashboard. If you come to my office, bigger than this screen, I have a screen in my office where I can see every single data. It's available on my mobile, it's available for my whole team on the laptop, and we can see the real-time data, and that can be used in future for many other things. Next. Then this is the complaint management system. Anybody can lodge a complaint for any service right from a hospital door, from his bedroom facility, through web, through mobile app, or through hospital counters. Next. Now these are the challenges. The couple of challenges I can highlight very fast. Last 72 years, we were not able to ensure the proper accessibility. Still, all our healthcare facilities, like education facilities, are totally focused in the urbanized hub centers. If I tell you about KP, one Peshawar, half Abbottabad, KP is finished. One Karachi, half Hyderabad, quarter Sakkar, there is no facilities in the upper Sindh. If you see the Balochistan, one Quetta, less than quarter Khuzdar, there is no facility overall for tertiary care in the whole Balochistan. If you come to Punjab, except the 10 top urban cities, where we have, except Lahore, have mediocre facilities and little Multan, we have no facilities in tertiary care. Next. Now, universal health coverage. Next. Now, this is the box you can see with regard to the population coverage, service coverage, and the cost coverage. Next. We have a different financing models available in the world. What financing model we are going to adopt? Should we continue with the state-sponsored, or we need to adopt a contributing mechanism? This topic is under discussion in the policy quarters with us. Next. Currently, whole of AJK, Tharparkar, FATA, and KP, they are fully covered. Right from the Chief Minister or Prime Minister of AJK to everybody is covered for universal health coverage. By the end of this year, whole Punjab, when I say whole Punjab, it means 120 million population, which is the 10th largest population in the world if we see on the country size. So whole Punjab, whole GB, whole Islamabad, inshallah, will be covered on 31st of December. Next. Now, I have a little time constraint. I will just summarize my discussion. Next slides. What's going to happen with this universal health coverage? I will just wrap up in a couple of sentences. A, poverty elevation. Nobody anymore fall below the poverty lines for not having money in the pocket after having this health card. And when you get rid of such kind of problem from your mind, you have two impacts. One is a peace of mind, your psychological peace, and more than this is all your resources, which is going to be used on the health, now can be diverted for the benefits, for the productivity, on the other aspects of your family. And the last, but not the least, in 72, 73 years, as I mentioned, we were able to create very few hospital facilities. In the whole of AJK, in the whole of the GB, we don't have an oncology or cardiology facility. But how long? How long we can leave our people like this? With this program, in every single district of Pakistan, the new healthcare facilities will emerge, not by government of Pakistan, but the private sector of Pakistan. I can share my experience. 3 years ago, we were universalized the FATA, and then more than 25% new hospitals emerge in the FATA. Same is going to happen for every district of Pakistan, whether it's Tandolayar, whether it's Loralai. We will have a facility at the doorstep.